Hi, I'm Gary, the ER nurse, and I have a question for you. What the heck is in these things? Rainbow, draw it all. Emergency room nurses draw blood work multiple times a shift. We have a recommended draw order. We know what tubes are needed, but do we know what additives are actually in these tubes and what do they do? Well, that's our topic for today. So let's get started. Now, we're going to take this in the recommended draw order for my facility, and that means we're going to start with the light blue or coags. Now, depending on what type of IV system you're using, you may need to draw a waste tube, like a red top, first to eliminate any air in that line. Now, we use Nexivas, which backfill that line, so I don't have to worry about it. So back to the light blue. It needs to be filled to the line, no air. Now, it contains an additive called sodium citrate 3.2%, which binds to calcium ions and prevents clotting. We use this primarily to check coagulation studies such as PTINR, PTT, a D-dimer, and fibrinogen levels. The red top. It can be used as a waste. It doesn't contain any additives and is used to detect certain autoimmune diseases such as rheumatoid arthritis, systemic lupus, and scleroderma. We also use it to look for infections such as hepatitis C. A gold top, or SST, contains separating gel and clot activators, which are microscopic silica particles. Now, these particles activate the coagulation cascade, causing the blood to clot rapidly, typically within 30 minutes. Now, the separating gel located at the bottom of the tube, when centrifuged, helps form a stable barrier between the serum and the clotted blood cells. Now, some common tests that we run in the emergency department include chemistry, such as a BMP or CMP, endocrine and serology tests, including hepatitis and HIV. Next is the mint green. Now, this contains lithium heparin with plasma gel separator. The gel acts as a barrier separating the plasma from the blood cells after centrifugation, and the lithium heparin prevents blood from clotting. Now, this can be used for chemistries, but we typically use it for troponins, which is a heart enzyme, and if we put it on ice, ammonia levels. Next is the dark green tube with a stripe, and this contains lithium heparin. Now, when used with a gel separator, a wide range of chemistry tests, including electrolytes, hormones, and other enzymatic assays can be run. Next is the lavender or purple top. Now, this contains K2E or K2EDTA. And I'm not going to try and pronounce this. You can look it up on your own. Now, this binds the calcium ions and prevents clotting. We use this to check a complete blood count, red blood cells, white blood cells, differential, etc. Finally, a gray top or lactic acid. Our lab requires these to be on ice and sent within 15 minutes of draw. Now, this tube contains sodium fluoride, which preserves glucose levels, and also contains potassium oxalate, which serves as an anticoagulant. We also use it to check serum blood glucose levels, but I rarely do that in the ER. Now, different hospitals may have different tubes to run certain tests. What kind of tubes do you use at your hospital that I didn't mention here? I'm Gary, the ER nurse. What else about nursing do you want to learn?